Okay, so today I'm going to show you how to start an IV. This is going to benefit you if you decide to go into nursing school. One of the biggest problems I had when I became a nurse was that I was having a very hard time starting IVs and drawing blood because that's a major part of my job. Because a lot of your doctors will order a liter of saline and then you have to start an IV and you have no access site. So one of the big signs and symptoms of infiltration, which is one of your complications with IV starting, is pain and swelling at the IV site. It's going to be coolness. Whenever you flush the IV, which is whenever you take normal saline into the end of the catheter and flush it through the vein, you will have pain. So a common placement for your IV is going to be the back of your hand. It's going to be in the bend of your arm. That's most common placement for adults. For children, it's going to be the top of the foot or the scalp. So many people are going into nursing school, and the mastering of this skill now would tremendously help you in the long run. Starting an IV is a very hard skill to learn. It takes a lot of practice, a lot of complications, a lot of messing up. You're going to spend most of your time hitting the wrong vein, to be honest. It took me a year before I was able to start an IV correctly. So the first thing you want to do is gather your materials. You're going to need a tourniquet, you're going to need an alcohol swab, you're going to need the appropriate sized needle. Make sure you have 2 or 3 flushes to make sure that your IV is placed properly. You also need to make sure that you know where the most prominent vein is in your patient. So secondly, you're going to introduce yourself to your patient. When you do this, you're going to take away so much stress from your resident. Telling them who you are, what your title is and everything kind of calms them down. So that helps a lot. So you're going to prepare your IV tubing whenever you go into the room, and after you introduce yourself, you're going to make sure that you prime the IV tubing from the IV bag, because you don't want to have all that air going into the vein. So after that, you're going to choose a suitable gauge catheter for your situation. You're going to put on sterile gloves and look for the correct vein in your resident. So most importantly, that would be the back of the hand, in the middle of the hand, or in the bend of your arm. Most people don't like to place it in the bend of the arm because if you have a resident who has dementia, they like to lay with their arm above their head or anything, and it'll clamp off your gauge of your IV and it'll stop the IV from going in completely. After that, you're going to apply a tourniquet. You're going to access the vein and disinfect your IV site, because that is the most important thing to do, is to make sure you disinfect. You don't want to introduce bacteria into that vein and cause sepsis in the long run. So you're going to insert your needle into the vein and discard the used needle into the sharps box, and then hang your IV on your IV pole. So usually whenever you go into the bend of your arm for placing an IV, you can use like a triangle on your arm right here, and you can see these veins. This one right here would be most suitable for me. You always want to make sure that you hit that vein correctly, because if you go through the vein, if you go beside the vein, it's not going to work. So you're going to remove the needle from its sterile package and insert the needle using your dominant hand. And with the bevel, which is the hole in the tip of the needle, you're going to always make sure that's facing upwards. So as you advance the needle into the vein, always make sure to reduce the angle of insertion. So when you go in, you want to make sure you reduce your angle as you're going in, and make sure you go flush with the vein. So once you do that, you're going to look for something called flash, which is basically whenever you insert your needle into the vein, you will see blood come up through the tip of the needle. So after you see the flash, you're going to advance the needle into the vein 1 centimeter. So you're going to maintain pressure on the skin, and you're going to pull only the needle out. You want to make sure that catheter stays into the vein, because your catheter is what's going to be used to insert all medication into that vein. You never want to leave the needle in the vein. Always make sure you remove the tourniquet. If you don't remove the tourniquet, you can risk necrosis of an arm. I mean, you can somebody could end up losing their arm. So you always want to make sure that you care for your IV correctly. You're going to disinfect around your IV site after you place the IV, because whenever you place an IV, you're always going to have blood leakage and everything around the IV site. You're going to make sure you clean that up. I always put Tegaderm over my IV placement to keep it intact. Some people use Coband, but Coband's very tight and it can cause, like if somebody has edema in their arm, which is fluid buildup in their arm, that can cause a lot of pressure on their arm. So I always use Tegaderm or maybe even Kerlix, which is just sterile gauze. After you do that, you're going to make sure that you always keep the IV site clean, dry, and intact. You're going to monitor for infiltration and infection. One of your biggest signs of infection is yellow pus. Whenever you see that, always make sure you take the IV out. If you see infiltration, you immediately take the IV out. That's pain, coolness, redness at the IV site. So basically when that happens, you're risking somebody getting sepsis, and you're going to have to go in the opposite arm to start the IV, or in the opposite hand, wherever you've chose to start that IV at. You're going to prevent tugging or pulling on the IV tubing and the site, because if something ever happens and it gets tugged, you can risk pulling that catheter out a little bit and you'll have to start all over again too. You'll have to start over in a different arm or a different hand. One of the biggest things also with starting IVs is you cannot, like if somebody has a PICC line, you can't go in that arm. If somebody's had a mastectomy, which is the removal of one of their breasts because of breast cancer or anything, you have to go in the opposite arm. If somebody's had a stroke and they have weakness in that arm, you have to go in the other arm. So I hope this helps you in the long run if you're going into nursing school, if you're going into any healthcare profession. It's extremely hard. Like I said, it took me about a year to be able to actually start an IV correctly and to successfully start an IV. So I hope this helps you if you're going into nursing school, if you're getting ready to start clinicals or anything, and I thank you for your attention.